tusikie kama Okay, good evening viewers. Karibuni sana to Talk to Your Doctor show. My name is Washera. I'm your host today, and today we are talking about lower back pain. And just like you're seeing behind us, you can see the special clinics just right here with us. We do dialysis every day, nutritionist every day, and tomorrow being a Tuesday, we'll be having a urologist clinic, so you can come over for urology clinic every Tuesday. We'll also be having a ENT surgeon tomorrow on Tuesday, so keep checking on us. And today we are talking about lower back pain. We have a physiotherapist on board who will be talking to us about lower back pain. So you can ask all the questions on our platforms at TENRI Children's Hospital. You can ask all the questions that you have, and Dr. will be here to answer all of them. So Dr. karibu sana to the show.
Thank you so much.
You can introduce yourself to the viewers so they can know you more and be able to interact with you as we'll be here for the next 30 minutes. Introduce yourself and then we continue with the show.
Good evening, viewers. As you have heard, I'm Samuel Ombatishua. I'm the clinical physiotherapist, also orthopedics physiotherapist at TENRI Hospital. You're welcome for today's topic. Today we're going to discuss again about low back pain. This is the second time I'm sure we're talking about it. So, karibu sana. Let's solve all your problems today.
Awesome. I think before you start, you need to tell us why would you choose to do physiotherapy to patients instead of doing, clinical medicine and other things? Why did you choose to do clinical?
Oh, wow.
Yes.
So I have a really, I cannot say it's a good history or a bad history, but at least I can say the reason as to why I chose to do physiotherapy is I saw what it has done before. My grandfather back then had a problem, and the problem was stroke, and we had to get a physiotherapist who could help in rehabilitating him.
Yeah.
But unfortunately, it was so hard because there were a few, I think, back then he was admitted at a certain hospital at home, and then we had to go look for a physiotherapist from a different hospital, So that is so, I can say it's tiring, especially when you have a patient, but you don't have someone who can attend to them. So it really made me think of maybe what if I do it and then I'll be helping even more.
Nice. Yeah. And then you're touching so many lives out here.
Thank you so much.
Because like today I know you've seen a lot of patients, and even you find a created time to be here today.
Thank you.
Yes. So today you can tell us, people confuse between massage and physiotherapy, and I understand that physiotherapy and massage are two different things.
That's true.
So can you tell people that massage and physiotherapy is a very different thing?
Well, physiotherapy is basically the use of both manual and let me use the term modalities. Modalities are the machines that help us in either relieving pain, improving the ranges of motion, and blah blah blah. So majorly we use physiotherapy is the use of modalities and physical activities, or let's say exercises by moving joints and stretching the muscles.
So today we talk about lower back pain because it's actually this is due to public demand. People are saying, I've had back pain. Can you talk about this? Because we had to talk initially about knee pain. So I've seen young people of my age and younger people having lower back pain. So can you tell us what is lower back pain?
Basically, lower back pain is any kind of pain that you experience at the lower back. So it has no definition because pain is that unpleasant feeling that you experience at either a part of the body, any part of the body. But now for the low back pain, this is just pain that is either located at the back or originates from the back.
Originates from the back.
Yes.
So what are some of the what are the symptoms of lower back pain? Because people do not maybe understand where is lower back pain exactly. So what are the symptoms?
So as we have used the term low back pain, majorly the back or the lower part of the back, it's the first place you'll experience that pain. Thus you'll say, utakuja hospitali useme, mimi naumwa na huku nyuma. The point at which you're pointing is the lower back. So the back has three segments. We have the first segment is the neck segment. We call it the cervical segment. The cervical segment starts from just around, let's say the kisogo. Yes, in Kiswahili, kisogo. So it starts from the kisogo, and then you move down about 7 to it's 7 bones below. So that's where the cervical region ends. And then we have the thoracic region. The thoracic region also begins from now after the 7th bone arm of the vertebra. Now we have now the thoracic region. It has 12 bones, so they all range from that side, from just below the cervical region, the sub 12 bones below. Now from there, what we have is the lumbar region. That's where mostly we call it the lower back. So it has 5 bones that makes the lumbar region. Also, there's another segment that is more forgotten, like I'd say. We call it the sacrum. It's also part of the back. Yes. So for the symptoms of low back pain, majorly they'll start at the lowest region, that is the lumbar area, and they could go down to the sacrum area or to the tail. We call it the coccygeal.
Oh, the tail of the human body.
Yes.
Okay, so when someone comes with lower back pain to the clinic or to the hospital, what are the first, maybe they call, okay, before we do treatment, what causes lower back pain?
Well, let's touch the symptoms first.
The symptoms.
There are various symptoms of low back pain. Sometimes someone will come to our clinic. They just complain, I'm experiencing pain below the buttocks. Sometimes it could go down to the knees. Sometimes it could go even down to the ankle and even to the big toe, or both toes. It could also be pain coming from just the back, and then it comes around your abdomen, and also comes towards the what can we call it? The groin area. Yes, towards the groin area. Yes. So there are various symptoms of low back pain and how it comes. So someone will tell you, I experience low back pain on only one side, and then the pain just goes down to the toe. That's low back pain. Someone will also tell you, I have a problem, my back sometimes pains, but majority of the pain comes towards the knee. It's also low back pain.
You sure? So if someone comes with lower back pain and then it's on one side, is it the same lower back pain?
Now, when you put it into halves or side of the back, we go further into subdividing now the type of low back pain. We have about 5 types of low back pain, and the first low back pain is the one that is associated with numbness or tingling sensation. Normally this is the kind of pain that originates from the low back pain, and then from the low back region, and then it follows just a straight line, goes down to it passes the knee and then goes down to the ankle. Sometimes it could reach at the calf muscles, or sometimes just down. Another, we call it low back pain with radiculated or radicular pain. Radicular pain is the pain that you experience going in one line. Most people say, I have sciatica. Sciatica is just a nerve, but also it could be a condition. It's because now that nerve has an issue. That's why you're experiencing that kind of pain. But you cannot just say it's sciatica if you haven't certified that it's the one that is causing this kind of pain. Because sometimes there could be just a problem at the back, but causing that kind of pain.
Okay. Yes. We got to what are the main causes? What causes lower?
There are many causes of low back pain. Some could be contributed by either a strain or a sprain. Mostly we strain our muscles and our ligaments, especially people that do high, I can say the kind of job that they do, they lift heavy weights or twisting, sometimes awkwardly. It could cause a strain to the muscles. We have muscles that support the back, muscles that give the back the stability, also the muscles that can make you bend and come back, or bend backwards, or also bend to the side and then to the side. So that can also cause the pain. Number 2, we can have a fracture. fracture of the spine for people, maybe they had an accident, or they were hit by a blunt object at the back, or they just fell. Sometimes you can fall and then you experience a fracture.
Yeah.
Yes. Also, low back pain can be caused because of degenerative changes in the back, especially for people that have aged, people that are, let's for someone whose age is someone who is above 45 years, let's put it that way, above 45 years of age, now there are early signs of degeneration. That can cause low back pain. For a condition we call spondylosis, it's associated with degeneration. Also, you can have spinal problems. For example, the spinal cord being compressed. When the spinal cord has been compressed, it could also cause now the kind of pain that you experience going down to the limbs. Sometimes you'd experience weakness. Sometimes you'd experience loss of function of both legs, depending on the severity of the injury to the spine.
Okay.
Yes. Also, it could be caused by disc problems. Discs, these are, let's use the word cartilage. They are in between one bone and then the other one. So they help in their shock absorbers, or they cushion the vertebra and the spine itself. So when they have a problem, especially when you have a disc bulge or disc herniation, they could also cause low back pain.
The one we've talked about, the disc, can it happen when someone hasn't fallen down, hasn't had an injury? Can it just happen?
Sometimes it can, sometimes, but very rare, but it can, especially for people that are overweight. You see that weight exerting on your spine, it could make the disc bad.
Because now I know of someone who has added weight all of a sudden, and then they had some lower back pain, they had pain all over, so it could have been the cause.
Yes. So you see, this is more like you're putting pressure on your back. And when you put a lot of pressure, and your muscles, or generally your back stabilizers, they are not that strong enough to stabilize the back. So when the weight is exerted on you, it compresses the vertebra, and then the disc, since the disc is just in between one vertebra and another, so the weight compresses. Whatever content that is inside there bulges out where there's a space. And when that happens, sometimes it leads to compression of the nerves that are exiting from the spinal cord. Yes.
Okay, having dealt with the causes of lower back pain, how do you, when a patient comes to the hospital and they tell you all those symptoms, how do you treat now lower back pain?
So lower back pain has the treatment. Treatment begins with you. Yes, it begins with you. For example, the reason that's why I'm saying treatment begins with you. For example, someone can come to you and then they explain their problem. They tell you, nikiinama daktari ndio ninaumwa na uchungu. Ama whenever I'm doing any activity yenye ninafanya niname, ndio ninasikia uchungu. Nikisimama mimi niko sawa. Nikitembea niko sawa. At night ukilala you're okay. But only wakati nina bend ama nafanya activities about bending. Number one, we start by beginning, we begin by reducing the activity. Or reducing whatever that is causing this pain. So you prevent it first. So kama kuinama ndio iko na problem. First prevent. Don't usibend for long, so that you resume now treatment, and then you tarudia to go back to kuinama. So the first treatment is you. Bending is the problem. Bending is the one that's causing the problem. Avoid bending.
So stop bending.
Don't stop bending, but avoid bending.
Okay.
Yes.
What is another treatment other than that?
Now, after now it has started with your night, it's now our part.
Sure.
So our part begins by taking the history. Now you've already taken that history. And then now we move to examination. This is where now we are going to do physical examination, so that we see what kind of low back pain. I didn't explain the rest types of low back pain, because we have other types like low back pain with reduced ranges of motion. This is when you have low back pain, but it limits you from going down or going backwards. That's bending backwards, bending to the side. But these other activities, you're okay. And so once we do our examination, we know which kind of pain are you having, and what are the causes, what caused this kind of pain. Sometimes I didn't touch about Some other causes of low back pain could be internal organs, for example, the kidney. For example, when you have a problem with cancer, it could also cause the pain at the back. Yes.
Yeah.
Sometimes we have this joint we call the sacroiliac joint. Sometimes about 20% of our patients they complain of low back pain, but it's related to the sacrum, so the sacroiliac joint, not necessarily the back itself. Yes. So once we do the examination, we want to first know what are the problems that this pain or this back pain has caused.
Yeah.
Can you bend well? Yes, I can. To the side, to the other side, yes. Backwards, yes. So what time do you experience this kind of? This is going to lead us to know the kind of pain that we are dealing with. So if it's cancer, for example, cancer behaves, for example, this loss of weight. So 10 kgs in the last month, you lost 10 kgs, but you're still experiencing severe low back pain.
Yeah.
So we have to dig deep. Why have severe low back pain? Why did you lose these 10 kgs? Is it that it happened because you wanted to lose the kgs, or it just happened gradually? Or are you on fasting? Maybe inaweza kuwa uko shakahola na tujui. So we really need to know all this.
Yes.
Yes. So after that, we start by eliminating one problem by another, one problem after another.
Yeah.
So we remain with that one problem that is now the condition that we are going to manage. Yeah.
So what are some of the things you use the machines for someone who has lower back pain? What do you do?
So for someone who has lower back pain, patient has just come for the first time.
Yes.
We have done our subjective examination where we know now what caused the pain. We have ruled out other problems. The biggest problem that we normally rule out, number one, is cancers. Number two, we rule out anything that is spinal injuries. Number three, we rule out TB of the spine. I didn't touch about it. Tuberculosis of the spine is also a causative agent to low back pain. Sometimes someone can be having TB and they don't know because they exposed themselves to this pulmonary TB. Maybe they underwent medication, but now it has mutated to the back. Sometimes when it happens, we also need to rule it out because it's a risk factor for or we call it a red flag for physiotherapy, especially when it comes to low back pain. Yes. So people with, for example, TB spine, they come with, sometimes they don't have functions of the lower limbs. The legs are not functional. They are unable to do movements of the legs, sometimes even passing urine, sometimes even going to pass stool. Sometimes it could be a problem. So when we have a patient that has such problems, we put it as a red flag. So we really need to dig down. Why did this patient come with incontinence, or they are unable to pass urine, they are unable to pass stool, and they have weakness? Why did it happen? So we do either it's a CT scan or MRI to rule out this other problem. Because when such happens, it's highly likely to be related with either the spine or nerves.
Yeah.
Yes. So once the patient comes in and we've done all the ruling out of those risk factors, we now come to the normal activities. Can you bend? For example, your keys were down, you need to pick them up.
Yeah.
Can you do that? If you cannot, why can't you? Is it painful? Sometimes we go into an extent of doing, I'll call it passively. So I'll bend you passively, not by yourself, but I'll do it personally. So that we see, is it that the limitation it's from the muscle or from the pain or from the joints?
So the treatment is very wide, depending on the patient who has come to the hospital. So what are some of the maybe prevention measures that maybe people can do, especially those who sit in the offices maybe for a long time, they're sitting on chairs? What is the prevention of lower back pain?
Prevention. Before we prevent, let's first treat now our patient.
Yeah.
So we have ruled out the risk factors. We have machines like the infrared rays. This machine helps in relieving pain. It produces light that is hot.
Yeah.
So when we place the infrared on the area, for example, we are talking about the back. So when we direct it to the back, we are trying to reduce inflammation, and we are trying to relieve the pain. Yes. So we have another machine by the name TENS. This is a nerve stimulating machine. So it works when we want to relieve pain. At the same time, we want to stimulate the nerves. So this machine works in a way that the body has its own painkillers, endorphins. These endorphins, once you use the machine, the TENS, it reactivates those endorphins, or it tells the brain, now release those endorphins to that area that has a problem. That's why we use the TENS machine. Also, we use it for people that have nerve issues. For example, you have a problem with the numbness, there's tingling, and then it's associated with the back. So we use it to stimulate your nerves. Yes.
Is there any other treatment for
yeah, sure. There are many. We also have another one by the name hydrocollator. This is a machine that produces heat through boiling water. So after you boil the water, we use the boiled water, we use a pack called a hot pack. They are filled with silicone so that they can store heat for a prolonged period between 20 to 40 minutes. So when you place the hot pack on your back, it relieves the pain. Yes.
What about the cold pack?
The cold pack, ice is also a good one, especially for acute injuries for the back. This is someone that comes in with I fell, or I was doing a lift, and then I did or I lifted it awkwardly, and then nikasikia sharp pain at the back. We can use that also. Yes.
Is there a possibility that you just start having some lower back pain, and then for after a while, maybe a month, it start healing itself? Is there a possibility?
Yes. Low back pain, sometimes they are non-specific. This is just pain that comes for no reason. And then it wears off by itself without taking medicine, without doing anything. Yes.
What about medication?
Medication.
Yes.
We normally advise, especially when now the pain is so severe, we advise to take muscle relaxant or just these normal painkillers. Yes.
And then you continue now with the therapy?
And then now we continue now with the therapy. The therapy now, it depends. You might find someone who does manual therapy. It depends. You might go to a different hospital that doesn't have someone who does manual therapy. And for manual therapy now, personally, I like doing manual therapy combined with the modalities, because that's why I went to school anyway. So when you do the manual therapy, we also have to rule out other problems. For example, if there is instability of the back, because when you do manual therapy, you have to put some pressure on the back, and then we do some twistings. Wengine wanaita chiropractor. I'm not one, but we can do that. Yes. So when you combine manual therapy, you combine it with the machines, and then now you finish by using exercises. The outcome is normally good. Yes.
So the treatment, how long does the treatment take, maybe for one person to another?
So it varies depending on the course, depending on the level at which we have types of low back pain. There is acute. Acute. This is the low back pain that didn't last for more than between 1 day to at least 1 month. We have chronic too. No, we have chronic. Chronic is anything that has been there for more than 3 months. That's chronic pain. You know, now there's a difference. The reason as to why we have to put it that way, there's a difference between acute pain and chronic pain. Acute pain, this is pain that just came recently. And the prognosis or the recovery of such kind of pain is usually quick, because it's not a problem that began a long time ago. But when you have a chronic case, this is a problem that has been there, maybe recurring. Unakuja hospitali, unapewa dawa, inapona. After 3 months again, you come back about the same problem. And then maybe you do physio, a few sessions, 5 sessions, 6, you feel well, and then you go back home.
Yeah.
After a few, maybe 1 year, and then you come back. So you know, this is a recurrent kind of pain. It's as much as it will go away, it's not the same. It will not take the same amount of time as the one that has acute lower back pain. Yes.
And what are the ages? Maybe the ages maybe from 30 to 50 who are in the risk of having lower back pain?
Lower back pain now currently we have patients from all ages,
including children.
Sometimes you'll find someone, children, let's say 8 years old, 6. Sometimes they come with, they even say it's severe lower back pain, but after 2 sessions they get well, they go back to yes. Also, majority of our patients are patients above 40 years of age. Yes. Those are most people that are complaining of low back pain. Yeah. It doesn't have really it doesn't have an age limit where you say low back pain shouldn't be here by at this age, because it depends. What did you do that caused that pain? Yes. Sometimes, as we said, it could be a strain. Yes.
It could be a strain.
Yes.
So anyone can come complaining of lower back pain.
But we do not expect someone who is younger than 20 to complain of lower back pain more than 1 week.
More than 1 week?
Yes.
Who is less than 20?
Yes.
But above 20, they can come complaining.
They can come, because now they at least hao unajua wamekula maisha kidogo. There are very many things that they are doing that can contribute to that pain. But mtu mwenye ako below that age, I don't think it's majorly it's rare unless they have associated problems, maybe from the kidneys. They have issues from maybe the stomach, because also people with a problem like urine problems, especially UTIs, they could complain of low back pain.
Of lower back pain.
Yes, yes.
I've also seen women who have had a child through CS complain of lower back pain. So what makes that happen?
Well, low back pain in pregnancy, it could be associated with very many things. Sometimes, number one, it could be because now, you know, as the baby grows, our muscles are stretching. Yeah. And one of the core muscles are the abdominal muscles. So if you have the abdominal muscles weak, your back, you are likely to complain of lower back pain. Yeah, sure. So when the abdominal muscles keep on stretching, they, you know, the stress is put from the back. It's not only hapo kwa tumbo tu peke yake. So it causes you pain. Yes. It could be just niku strain too. Yeah. Yes.
And people need to know not to do things which makes them strain, so that the pain can go.
Yes. Number one, to avoid straining.
Yeah.
Exercise.
Yeah.
Make sure your muscles are well strong enough. Your back is stable. We normally train people on how to stabilize their back. We will teach you how you are supposed to hold. For example, you want to bend, but when you're trying to bend, there's a problem. But when you stabilize the back itself, you can do that. So we will teach people on how to stabilize. There are exercises that are programmed for just stabilizing the back. Yeah, I mean the lumbar region and the pelvic region.
And then there's a way you bend, and then you'll not have pain. There's a way you'll bend and you'll have pain.
Yes. So I wish I could have shown how we can do that, but that's now another time. Or we will record and then we put it for them so that they can see. Yes.
Okay, now what are maybe the prevention measures now of someone having lower back pain, or how can someone prevent having lower back pain?
The prevention.
Yes.
Prevention.
Measures, yes.
Number one, check on your posture. Yes.
Especially when you're sitting. Am I sitting right like myself? Or
do you feel like you're seated well? I'm
not sure.
So the number one the best way to sit is sit upright. Do not crouch. Yeah. So you sit upright.
Upright. Okay.
Yes. So once you've corrected your posture, your muscles are not going to strain a lot, because some people will tell you, nikikaa sana ndio nasikia. How are you sitting? Yeah. Some people will sit this way the entire day.
Yes.
you are you know you are straining your back.
Yeah, sure.
So sit upright. Number 2, avoid lifting awkwardly. If an object is heavy for you, get assistance.
Yeah.
Yes, get assistance. Kama uwezi, get assistance. Or use a machine that can help you. Because we strain a lot when we lift heavy objects.
Yeah, sure.
Yes. So once you do this repetitively, that strain leads to a problem. Yeah.
Okay, we can check on the feedback. Someone here is saying great show. Someone by the name Brenda Chepchumba anasema great information. We have Jonte saying good job with Dr. Sam Shua.
Oh, thank you, sir.
I think they are watching. Bevon Kimutai anasema informative and good presentation. Hey, there's one here, I don't know what he is saying. Okay. Hey, anasema samurai, I don't know. Maybe
he knows me. I think
knows
I think I know that guy. Thank you, Sarah, for tuning in.
Okay, someone is asking, do you use RESA insurance in your facility? Yes, we do.
Karibu sana.
Yes, and Gukemba Jr. is asking, is it true that lack of sex causes back pain? But I've heard that myth. Is it true?
I'm not going to answer that because I don't know also. I also don't know. Yes, itajibu.
Someone by Caroline Spencer Gaki is saying they are tuned in. Actually, people have asked that question many times. Yeah. Someone else is asking the same. Doctor, what's the relation between lower back pain and that one?
Well,
yes. So I think people are asking that because I've had a mate pay saying, oh, when you stay for long, you have lower back pain.
Maybe, because there's a lot of movements that happen at the back during that act, so I don't know.
It can
onward.
Okay.
It depends with who is talking. Maybe whenever they have stayed for a long time without it, they have pain. Okay.
Okay, there's someone here by Andrew Mwangi saying good work. Gatune Brian is tuned in. I think so many people are tuned in. So as we are winding up, because I can see our 30 minutes are coming to an end, what can you tell our viewers? Or I can ask a question. How many people do you see like per day with having lower back pain? Out of the patients you see maybe in a week, in a month, which is the highest percent?
80% of our patients they come with lower back pain.
Lower back pain.
Yes. Or problems related with the lower back.
Lower back pain.
Yes.
Could we have what a percentage of chronic maybe diseases they have, which is causing lower back pain? What percentage?
Let's say I haven't done an analysis so that we know those that are caused by other problems, but I can say we have about 3 or 4 patients that have other problems that now are causing the lower. For example, we have people with that TB spine, and we are managing it well. Yeah.
Oh, nice one.
Yes.
So, and it can get healed. When someone has TB spine, do they have to do medication and do therapy?
Yes.
So how is it diagnosed when you have the TB spine?
TB spine. The best way to know that there is a problem that is you are suspecting is TB spine is through doing an MRI. Yes.
Okay.
An MRI will rule out TB spine better than doing a CT scan. Yes.
Oh, nice one.
Because it will show the level of the compression to the spine. Also how that vertebra, because whenever you have TB spine, it eats literally the bone or the vertebral bone. So whenever it affects there, it gets even more severe to the spinal cord. Yes.
Can it eat the bone fully? Like
I haven't seen one that is completely out because it has been destroyed by the TB, but most of them you will find it affected. Yes.
Another feedback here, someone by the name of Lekitoe saying good work. We have Minyo saying wazi.
Asante sana daktari. You're a good friend.
Nice
Yes,
one.
yes.
So madaktari wanawatch hii show manze.
A very good friend of mine.
Nice one. So I think we don't have more feedback, but I can see the feedback. People are coming in because they have seen we are responding to their feedback. I hope next time we'll do some. We'll show people.
We will do exercises.
Yes,
I think we will get a bigger space so that we can do exercises.
Yes.
And so that we can demonstrate each exercise, how it's done, how long are you supposed to do it, and how correctly are you supposed to do it.
Okay.
Yes. We have almost 20 exercises. So I hope we can find time and then do them.
I think next show we should do that show people so that they can do it even at
home.
home.
Or also we can get a patient so that we seek consent from the patient and then we treat the patient online. There's no problem. As long as the patient has accepted.
Yes, sure.
Yeah.
I can also be the patient.
You can also be the patient. There's no problem.
Or someone else can be the patient. If you tell me you'd like to be our patient that day, hautakuwa mgonjwa, you'll just come, you show us
hata kuwa mgonjwa, it's okay. It's actually good when you have a real patient, so that when we are doing this examination or to the point of treatment, so that we do it with a real problem. Yes.
Oh, nice one. I can see people are saying good job. I think they are glad that we are doing this online.
Thank you so much for switching.
Yeah, and then another one, do your patient use Lesa? I think LIB insurance muko ndani ya show. Yes, we are using LIB Lesa insurance here at TENRI, in all our branches in town, Majimbo, and even in ENA. So you can come over for all these services. Actually, you can tell them about your services, what you do, and the days you do them.
Sure.
Yes.
Now, apart from managing low back pain, we also manage other problems. For example, what we were supposed to discuss about today, knee pain. We also manage other problems like paralysis of the face, by the way.
Yes.
We call it Bell's palsy or facial palsy. We also manage that. We manage stroke quite well. We manage, it's a myriad of problems. And we have our clinic at Majimbo and both at ENA. Yes. So working
every
from
day.
Monday to Saturday from 8 to 5. Sunday at Majimbo.
At Majimbo. Sunday at Majimbo.
Yes.
So it 7 days in a week.
Yes.
So they can come over.
They can come over anytime. As long as it's from 8 to 5, we will help you.
One last question. If someone has stroke, is there a possibility of that person maybe able to walk again, regaining strength again after they've had stroke?
So for stroke, I think we will need to have time to talk about it because stroke is also too wide and it will depend with the severity of the stroke.
Yeah, sure.
Yes. It will depend. We cannot say that this person is not going to work because they have stroke or is going to work because they have stroke. Yes, it's quite wide.
Okay.
Yes.
Oh, nice one. So we wind up the show. You can tell people your last comments as you're winding up, Dr.
Okay, thank you so much. It's been a good show.
Yeah.
I'm glad my friends, our patients, and everybody that has joined us.
Yes.
I'm happy.
Yes.
We will be doing this every more often so that we educate our people, let them know how the problems that they're undergoing, they're not the only ones that are undergoing them, and we are here to help them.
Sure.
Yeah. So, karibu sana. I've appreciated. Maswali mingi ziendelee kukuja. You can find us at our Facebook page. Waweke maswali.
Waweke maswali, utajibu yote.
Nitajibu. Na pia wakitaka kukuja DM pia wanitafute. We will talk.
Oh, nice one.
Yes.
So thank you for finding time for us. And thank you even for being here. We appreciate you so much for finding time for us. Dear viewers, we appreciate you for tuning in. Today you've tuned in Lunch Lovers. You can share the conversation with your friends so they can learn more about lower back pain and all other things we talk about in our Facebook page, TENRI Embu Children's Hospital. We have been with Dr. Shua, Sam Shua, who is our physiotherapist at TENRI Embu. And thank you so much for tuning. tuning in. Next time we'll talk about another thing. You can also suggest the topic that you'd like us to talk about, and we appreciate you so much for tuning in. I have been your host. You can also talk to us using our mobile lines 0723 386 706, 0723 386 706, or 0718 918 189, or you can write to us on our Facebook page or even on our website, and we can answer all the questions and all or book clinics with us, maybe for physiotherapy. If you're using insurance, using cash, you can be able to come over at our hospital and you'll be helped. Thank you so much for tuning in. I appreciate. I am your host, Washera. This is Talk to Your Doctor Show. Until next time, see you.